Medical bills can be daunting. The cost often is more than people can afford. But what if we told you the price could be wrong and you could be paying far more than necessary? WRTV's Kaitlyn Kendall spoke to one woman on a mission to help patients pay less.
It changed our lives forever.
For Deb Jansen, seeing her kids hurt isn't easy.
Something I would never wish on anybody.
Last January, her world took a turn.
She was hit, they guesstimate, going between 80 to 90 miles an hour from behind.
The crash sent her daughter Taylor to the hospital. A concussion, tests, overnight stays, and a traumatic brain injury meant the medical bills piled up.
We are currently over $300,000 into medical bills.
Her insurance took care of a big chunk of it. Still, the out-of-pocket cost was a tough number to look at.
We just don't have the money right now to pay these bills, and that's what the biggest issue is.
It's a situation many people fall into. Medical bills just too high to pay for right up front.
We don't know what to do.
I help people all over the country.
Nolan works as a patient advocate, fighting for people just like Taylor.
I help overwhelmed patients make sense of their medical bills and health insurance claims and resolve issues and negotiate bills.
Nolan has decades of experience in the medical world, working in a physician's office management role before turning to help patients herself.
I think people have no idea.
She says the amount of wrong medical bills that are sent to people is shocking.
Started noticing how many opportunities for errors there were and how many bills were incorrect.
Which is why she started Clear Healthcare Advocacy. Based out of Carmel, she digs into medical bills and helps get totals adjusted.
Got to have the wherewithal and the patience and the time to dig in and try to figure it out.
She says there is so much that can be wrong on bills, from totals not being run through insurance, insurance not covering items they're supposed to, out-of-network costs being wrong, and more. Still, even if all of that is right, you could get a lower price.
A bill is correct, but it's overpriced. You can try to negotiate.
Hospitals are required by transparency rules to share on their website the cost of services provided. As for Jansen, she's noticed an error on her daughter's bills and is in the process of fighting it.
You need to look at your bills.
In Indianapolis.
And I'll take these bills any day over not having my daughter here.
Kaitlyn Kendall, WRTV.
Well, here are some of the top things you should do when you get a medical bill in the mail. First, look for the explanation of benefits. It shows how medical insurance processed the claim. Now, if you don't see what's called an EOB, it's possible insurance was never billed first. Second, negotiate the bill. Nolan says to not be afraid to call the hospital and ask for a lower price. And third, check to see what was covered by insurance. Many times things will be applied to a deductible that should have been covered by insurance. Further tips can be found in this story at our website at WRTV.com.